Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, if you're waiting to be seen at A&E, it could take a while, a long while, as NHS England revealed waiting times have reached record levels. Figures for this February show that the health service missed a whole range of key targets, from ambulance response times to bed blocking by elderly patients with nowhere to go. Health officials insisted that hospitals were coping well with increased demand, but Labour said it showed the system was on its knees and in crisis. Here's our health and social care correspondent, Victoria MacDonald.
The NHS had been preparing for the worst, and there it was, record-breakingly bad. The figures for February, released today, paint a picture of the health service struggling right across the board. The A&E figures alone show that 133 out of 138 trusts failed to meet the 4-hour waiting time target.
These are unprecedented times for funding squeeze, unprecedented times for increasing demand. The winter itself is not really the main issue because it's been a very mild winter. Staff have worked extremely hard against all odds, but there is a steady, inexorable rise in demand for care.
The NHS England figures show that only 87.8% of patients were seen in A&E departments within 4 hours of arrival, below the 95% target and the lowest level since records began. Other targets also missed include calls answered by the 111 phone service, ambulance response times, and one cancer treatment target, that is, the 62-day wait for treatment after a GP referral. North Middlesex Hospital on the outskirts of London had the unenviable distinction today of having the worst A&E figures in England. But they'd been expecting them, they said. January had been bad too. It hasn't always been this way, of course. In fact, up until last August, the A&E department here was consistently hitting that all-important 95% target. But then it all began to go wrong. And they tell us it's because they lost, over the space of a few months, 5 out of a team of 14 emergency department consultants. And no matter how hard they've tried to recruit, both here and from abroad, they simply haven't been able to fill those posts. They've had to resort to bringing in agency doctors, just as the government had ordered a crackdown on this. But in Chorley, in Lancashire, they've decided to temporarily close their A&E department because they don't have enough doctors there.
The reason we've taken this decision is actually to protect patient safety. The last thing I want for patients as a doctor coming into this unit is to not have the right staff to deal with the conditions that they're expecting to be treated within our hospital. And that's why we've made this move to actually protect patient safety.
Of course, the problems vary from hospital to hospital, but generally there is an increase in the number of patients and they are sicker and more frail. Nobody would be interviewed from the Department of Health, but NHS England said in a statement,
"We really are now seeing the effects of the delayed flu spike, which peaked in February and March this year, compared with pre-Christmas last winter. This was compounded by social care-related delayed hospital discharges, which are up by 40% compared with the same month last year."
Yet what most in the NHS acknowledge is that this is not a crisis. It is the new norm. The pressures are now year-round, with staff having to work ever harder just to keep going.
Well, we have been in contact with the Department of Health today to request an interview. No one was available, but they told us that hospitals are coping well with increased demand. Well, I'm joined now by the Labour Shadow Secretary of State for Health, Heidi Alexander, and from the Royal College of Emergency Medicine, Cliff Mann. Welcome to you both.
Thank you.
Let me start with you, Cliff. I used to think that winter was the season of illness and then things would get better in spring. We're now in spring and things are as bad, if not worse. Is this the new normal?
Well, I fear it may be if we don't do anything about it. So up until 16 months ago, we would normally recover in the spring and be pretty reasonable until the following winter. There's been almost no recovery in the last 16 months. Well, the reason is that actually the numbers of patients attending A&E have gone up, and I disagree. I don't think this is anything to do with flu, and I don't think it's anything to do with moving patients out of hospital in a timely fashion on this occasion. This is due to an increase in the number of people in our population, but in particular the demographic change. So currently there will be 90,000 more people over the age of 85 next Christmas than there were this Christmas, which is a very good thing. But if you are 85 or above and you attend an A&E department, there's an 85% chance that you will need to be admitted, whereas for other people there's a 25% chance. That's the key difference.
Let me put that to you then, Heidi Alexander. So the population is growing, it is aging, and it is ailing in fairly substantial numbers. That's not really the government's fault, is it?
Well, I think what is happening in our A&E departments at the moment is a direct consequence of government decisions over the last 5 or 6 years.
Including the demographic change?
But in terms of the ageing population, if you take £4.5 billion worth out of the adult social care budget, which means that older people don't have the support they need to remain well and independent at home, then of course that results in more people reaching a crisis point and requiring A&E. If you also don't invest adequately in GP services, it means that people often feel that A&E is the only place that they can go to get help. So what we're seeing in hospitals at the moment is a direct consequence of this government's decisions.
I mean, one can predict demographic changes, even something as dramatic as this one. So should the Labour government, when it was in power a few years back, have prepared for this sort of eventuality?
Well, I think if you compare the performance in A&E departments when Labour left office to what is happening at the moment, you will see a very marked deterioration. And Matt, it is very important just to remind ourselves of these figures, because these are the worst A&E performance figures ever published. We've seen back in February 2011, about 40,000 people were waiting more than 4 hours to be seen in A&E. That has shot up to 240,000 people in February of this year. That's 250,000 people.
Cliff Mann, has the strike by junior doctors exacerbated this situation, especially the latest downtick in numbers?
No, because up until now, the strikes have not affected emergency care, and therefore that's had a minimal effect upon these figures. OK,
so given these dramatic figures that we just talked about, what is the solution here? Should the government be throwing more money at it? Would that work? No, indeed not. We think that actually throwing money at it has historically been a very poor solution. Proper planning and proper services are what's required. We know that 25% of the people who attend A&E could be seen as well or better by either a pharmacist, a GP, a mental health worker. We should co-locate those services with our emergency departments, decongest them to the tune of 3 or 4 million patients a year. That would leave the staff in the A&E department to look after the sickest and most vulnerable. So this is about a reform of the whole system, isn't it? I don't think what we're talking about is putting hubs next to our A&E departments that have co-located services. This is not a revolution. So this is a practical solution. This is not so much about the government. This is a practical solution that according to Cliff Mann, is quite soluble.
Well, I think what Cliff proposes makes sense. But I would also say that there are underlying pressures which need to be resolved. And I go back to the point I made about cuts to social care, because A&E is often a barometer of pressure in a hospital. If you can't discharge people back home when they are well enough and fit enough to be discharged, then that creates pressure back up the system. And the reason why people can't be discharged is often because of a lack of support available in the community through social services.
So given the problems that we have, and given that we're facing another strike by junior doctors, what would you say to them at this stage? Well, I would say what we said in our statement last Monday, which echoed a lot of what Sir Bruce Keogh said. The emergency departments up and down the country will be safely staffed by more senior doctors, without a doubt. Where there is smaller hospitals, and that may be an issue, I'm sure that in those areas, some junior doctors may choose not to strike. And we have implored both sides neither to see this as an endorsement nor indeed a condemnation of the arguments. This is reasonable people acting in very difficult circumstances. OK, got to leave it there. Cliff Mann, Heidi Alexander, thanks very much.